Member statements. Member for Inuvik-Twin Lakes.
Thank you, Mr. Speaker. The Dempster Highway is the only way in and out of the Beaufort Delta by road. It's our lifeline to the rest of Canada. Yes, we are NWT residents, but there is no way for us to get to the rest of the NWT unless we drive through Yukon, BC, and Alberta at this time, or if we can afford to pay the high cost of an airline ticket, and many cannot. As many in this House are aware, the Yukon has opened its borders without isolation restrictions to those who are vaccinated. Everyone at home is waiting patiently for the ferries to go in, Diane, so they can hit the Dempster. But some still cannot afford this trip because they can't afford to drive because even if they did a weekend trip, they would have to isolate 8 to 14 days when they return. And I know when questioned, the Minister and the Premier have stated in the past will continue to state that it's up to the CPHO to change this order between the Yukon and the NWT. In the beginning of the pandemic, we did not know anything, nor did we have anything in place to protect the NWT and the residents, but that is not the case now after 14 months of being in a public health emergency state. The NWT and the Yukon have crushed the curve like they were asked to early on by using masks and socially distanced and staying put. We have vaccines in both territories that are leading the country in vaccination rates. We have excellent public health and healthcare staff on the ground to do contact tracing and testing. Residents have shown they can manage an outbreak despite communication confusion. There must be lessons learned if it was to happen again. There was no community spread, and we are down to 2 cases, and I am happy that none of the cases in the YK school outbreak ended up in the hospital, Mr. Speaker. We have the COVID Secretary monitoring the borders, and we know who's arriving in the NWT and have staff to investigate. We have 811 and Protect NWT set up for residents to contact and put plans in place. We have testing throughout the Northwest Territories with quick turnaround now. We have medical travel patients continuing to go for appointments in Alberta over the past year with no reports of medical travel patients returning with COVID. People are wearing masks in most public indoor spaces in Inuvik and the capital, as I'm witnessing. At this point, we need to know what risk measurements are being used to make decisions. When will we have an NWT Yukon bubble where NWT residents can travel back and forth without isolation when they return? I do not want answers now. I don't want answers now, and I do not want stats on COVID. The stats are NW3, Yukon 0. There are the stats. Thank you, Mr. Speaker.
Thank you, member for Inuvik-Twin Lakes. Member for Inuvik-Twin Lakes.
Thank you, Mr. Speaker. Mr. Speaker, my questions are for the Minister of Health and Social Services. As I mentioned in my statement, the importance of the Beaufort Delta-Yukon connection, and that we want clear answers, not statistics. I'd like to ask the Minister what risk measurements are being used to make decisions around border restrictions and movement of people of the NWT. Thank you, Mr. Speaker.
Thank you, member for Inuvik-Twin Lakes. Minister responsible for Health and Social Services.
Thank you, Mr. Speaker. Mr. Speaker, under the Public Health Act, the Chief Public Health Officer has the authority to make recommendations to me about travel, and they are then written into public health orders and enforced at this point by the COVID Secretariat. So it's a process that begins with the Chief Public Health Officer and ends up with me signing off. The issue about the travel exemption with the Yukon doesn't have to do with risk assessment. It has to do with verification of people being vaccinated. So the Yukon and BC have a common medical record system, but ours is different than theirs. And so there have been some negotiations underway about how to share information between the NWT and the Yukon to verify that people have in fact been vaccinated. Thank you.
Thank you, Minister. Oral questions. Member for Inuvik-Twin Lakes.
Thank you, Mr. Speaker. Just maybe offer some advice. Would it be easier for the person who's traveling in to have a copy of their record? And would that be sufficient as right now if we don't have an agreement? Thank you, Mr. Speaker.
Member for Inuvik-Twin Lakes. Minister responsible for Health and Social Services.
Yeah, thank you. I'm sure that that would be useful to, if you had a copy of your own, if you had your own immunization, but the information sharing would open it up to everyone without them having to obtain paper that indicates that they have been vaccinated. These discussions are well along, and I heard the Chief Public Health Officer say on the radio yesterday that she expected them to conclude shortly. I just want to add one more thing, and that is that the situation between ourselves and Yukon is what the whole world is now grappling with immunization records. How do we create a system that is private but effective in indicating immunization to other countries when we decide to travel internationally again? So this is a live issue at the moment, and we're seeing it right here with the travel exemption to Yukon. Thank you.
Thank you, Minister. Oral questions. Member for Inuvik-Twin Lakes.
Thank you, Mr. Speaker. You know, I mean, we've been traveling all over the world before COVID, and there are vaccinations that we need to have in order to enter some countries. And we, as a past public health nurse, I provided these vaccines and giving them their records, and they've been able to enter these countries. I don't understand why we can't go from Yukon to the Northwest Territories or vice versa. So I'm just going to move on. And has there been any discussion about a temporary absence right now that could provide Beaufort Delta residents to go into the Yukon for at least maybe 72 hours without having to isolate on coming home? We have no road access into Yellowknife, so those of people that are not from the region may not realize that. And there's no possible way we can go anywhere else in 72 hours if we have to be back across the border. Thank you, Mr. Speaker.
Thank you. Member for Inuvik-Twin Lakes, Minister responsible for Health and Social Services.
Thank you, Mr. Speaker. Mr. Speaker, it's my understanding that the CPHO is working on a travel exemption which would provide access to the Yukon that would be not time limited. I'm not aware of any work being done on a time limited option. Thank you.
Thank you, Minister. Final supplementary. Member for Inuvik-Twin Lakes.
Thank you, Mr. Speaker. The only reason I'm asking for the time limit is there's ongoing work, and if maybe this discussion could happen, that some of our residents could travel in, get what they need to do, pick up vehicles that have been there since November, months ago, because it's our, like I said, it's our lifeline. Thank you, Mr. Speaker.
Thank you, Member for Inuvik-Twin Lakes, Minister responsible for Health and Social Services.
Yeah, thank you, Mr. Speaker. I certainly will make sure that the CPHO hears that suggestion, and of course we appreciate the fact that people would like to get to Whitehorse and go shopping, pick up their vehicles and so on, and we look forward to making that happen as soon as possible. Thank you.
Thank you, Minister.